Public is kind of scared. When they come to surgery, they don't bother about anything else. They're scared of anesthesia. So anesthesia is a balancing act, and it's not always the elephant which does the balance. You must realize the ball is also balancing. So it's a ball which also, though it's an inanimate thing, it's also balancing along with the elephant to making sure that the elephant is standing well. So the work of the anesthetist and the surgeon goes hand in hand for a successful outcome. What is the role of the physician? Forever we keep saying, go get a physician opinion. Why do we do that? We are the physicians. We are the peri-operative physicians. We got to know what an ECG is. All this, we have to do it now for medical legal aspects because anesthesia was not developed as an individual specialty. They realized that they have to do it, so they sought the help of the physician. So we don't have to keep on doing it forever. We can change this attitude, and we have to become the peri-operative physicians, and we should know everything. In fact, no other field of medicine can know in detail, starting from the basic pharmacology. Madam is here. So starting from pharmacology, we do a lot of pharmacology. Going on to the super specialty, no other specialty can go through this kind of a thing. We've got to know all these things. And the decision on the type of anesthesia can be done only by the anesthesiologist. I told you already, the surgeon will have some kind of a fitness and all that, but he will not ask certain questions. He will not ask whether the patient has had anesthesia prior, whether there has been a family history of any other problem that the patient has had. All those things are not going to be the problem of a surgeon. Whereas you go and see a patient in the pre-op period, you're going to ask him the family history of malignant hyperpyrexia or the choline apnea or something like that. So those things can be done only by the anesthetist. Previous anesthesia, previous surgery, I'm sure the surgeon is not going to be too keen. In fact, once I had a patient who was taken up for an emergency appendix, and I had the habit of seeing the patient. It was 2 o'clock in the morning at Royal Hospital. I went there. It was a young girl, a 22-year-old girl, and I had seen the patient completely perfectly on a TSC 1, except for a small pain in the abdomen. I checked the abdomen also, and happened to see the abdomen, and I found a Med-Burney scar. I said, this person has already got a scar, so what was the problem? So this girl is saying, I already had an appendix 2 months ago. So then what happened is, then this was just a pain. It was just a postgraduate who was very enthusiastic, and then of course she had, maybe she had an MDS or something, but maybe she had an ovarian cyst, a twisted ovarian cyst or something. Of course, we did the surgery on her for something else. So we always say anesthetists are like the pilots in an aircraft. Why do we say that? Because we have to do a pre-anesthetic checkup. Just because the patient has had anesthesia on the same table, we had a lecture, excellent lecture in the morning by Dr. Anaesthesiology, who said the problems of what happens when you have a problem with the machine. So just because you've had anesthesia on the same machine the previous day, does not mean you can straight away go and start anesthesia. We have to do a pre-anesthetic checkup of the patient and the machine, even on the day of surgery. Sometimes, very often, the surgeons are coming to fight with us, saying, last week only you gave fitness for this patient, what happened today? You can be fine last week, I can be fine as I'm talking, I can collapse and have a heart attack anytime. So even the day before you start anesthesia, you have to check the pre-op evaluation planning. Before that you have to plan, and then of course this is the major thing. The takeoff and the landing is what is most important. So that is why we are always compared to the pilot. It is the takeoff and the landing where you can have a problem. Of course, cruising in between will not be a problem, not too much of a problem. That's when we can have a tea break. But usually, unless you have a catastrophe, in between. If you beat rough weather, then you're going to have a problem. Otherwise, everything is going to be fine. The papers, always the press keeps telling us, too much anesthesia, another patient approach. So there is nothing like a too much or too little. Unfortunately, we cannot give test dose for anesthetic agents. Patients can have anaphylaxis, patients can have a problem. So that is why every drug that we use in anesthesia practice are potentially dangerous drugs. In fact, once a lawyer asked me, can you kill with haloperidol? Can you say yes or no? All the anesthetic techniques for a better outcome of a modern surgical outcome. Suppose we were giving open drop ether, 1846. October 16, okay, that was when WTG Morton gave open drop ether and he gave it for a public demonstration. If we are doing the same thing today, can we be doing open heart surgeries? Can we be doing transplant surgeries? Can we be doing laparoscopic surgeries? No. It is the development in anesthesia along with the development in the surgical techniques and other things which has made surgery more important and the outcome, the surgical outcome has become better. So we must give credit to the Department of Anesthesia for improving all these techniques. Of course, this is a variety of patients that we see. Morning we'll be doing pediatrics, we'll be doing a newborn, and then again we'll have somebody who is 90 years old. I once had a patient in Isabel she was about 100 years old. She was 99, Ramchandra Medical College student. He was 19 years old, 20 years old. He came from pet surgery. He had severe asthma, acute severe asthma, and he wanted under general anesthesia. They wanted for pet under general anesthesia. I had seen him, and I said I had not seen him prior to anesthesia. I had seen him on the day of surgery, and I said, sorry, I can't do surgery, I can't give you anesthesia today for you. So he said, can you please talk to my father? Because he's a doctor practicing somewhere else. I said, of course I can. So he gave the phone to me and said, talk to him. So I talked to him and said, your son has got acute severe asthma, I can't be giving him this. This is what a doctor said. It's not a non-doctor. It's a doctor. He's been practicing elsewhere. So they have no idea about what is happening. So I think we have to take it through. We have to take it through even to because anesthesia is not taught as a curriculum during MBBS. We just have a lot of pharmacology during MBBS which they think is anesthesia. That is not what it is. Asking much question and saying, what did you have in the morning, just to start a conversation. He said, chapati and kurma. I said, this is 6 o'clock in the morning. It's 6 o'clock in the morning. I said, 6 o'clock in the morning, chapati and kurma. Maybe you're imagining, as a little boy will imagine. So I thought maybe he had it the previous night. So, Netrati satta. So okay, in that case I went to the mother, I asked her, Kurtingla, and the mother said, no, you told me not to give. I never gave him anything. So I went back to the patient and the little boy and said, Amma saying she's not giving you anything. Who told you Amma gave me? My grandmother gave me. So that was the kind of thing. And if I had not asked a single question while I started the IV line for the child, chapati and kurma on his trachea, you think I could have saved him? I won't be here. Maybe I'll be in jail. Nobody else will realize that. Nobody will say that this patient had aspiration because he had a need. All that they will say is, the patient came for a minor surgical procedure and Vasanthi killed him. Are here, 90 PGs are here. What happens to all of them at the end of it, after the course? This is not here. Why? Because they are not being given that importance. The anesthetist goes inside the operation theatre before the surgeon leaves after him. The stress that we go through is much more than any other department.